Walking through the whole thing?
Well, we're going to walk through the back today.
Okay. Working from the person's left. Check leg length on the table.
Okay, so now we've had the person, we've taken their pulse, we look at their tongue, we've taken their blood pressure, which we haven't actually practiced that, but maybe you all already know how to do that. And then we have the person stand in the box, which we have done that. And then, so when they lay down, I'm going to look and confirm if the person has a short leg, which Myra has a short right leg. So I put that in my brain that she has a short right leg. Huh?
I don't need the sheet.
Yeah, okay. Yeah, it would be better.
I'm not cold, I don't think.
Okay. All right.
Number 1, spinal rock.
All right, so then I just put my hand on the sacrum and use the heel of my hand and rock a few times, okay?
Number 2, spinal walk.
So then I put my finger right there on Gouda and I walk up.
If the sore vertebra is found, do the balance technique.
Okay, so she says, oh, that's sore. The tip of the spinious process. So then I go above and below the sore one and I work it out like that. And then I do this on both sides. You remember that manipulation? So I work that out. Okay? So then I go all the way up and then I have the person turn their head to the side and I touch the third eye like that. And I close my fingers in like that so I make the connection from top to bottom. Okay?
Number 3, spinal press.
Spinal press, where you're just going to push all the Watu Jaji. I love that word, Watu, Dr. Watu Jaji points. So I just push like that. Okay.
Number 4, spinal push.
Yeah. Oh, spinal push. Okay, so I'm going up. I feel this vertebrae here is out of alignment like that. And I say, breathe in, exhale.
Oh my God.
So that is a Chinese stretching technique called spinal push.
Whoa.
But that, you know, it's that 1-inch punch. But you don't have to do that one unless you like. I mean, I love to hear bones crack. Some people don't. And I also ask people how they feel about it too.
You only do it in the peak of the thoracic spine?
Right. Right there. That's usually where the misalignment is. Right there. This is in this area right here. It's hard to adjust with that spinal push anywhere else.
Do you do the spinal press on both sides or do you wait and cross?
Yeah, no, we're going to do it when we go back over because it'll say to do that.
All right. Number 5, scapula lift.
Okay, so I just put hand back like that and I lift the scapula. 2, 3, and right there, that spot's tight, so I focus on that a little bit more. Okay.
3 spots up it.
Yeah, more or less. I mean, you can spend more time than I'm going to do on all these manipulations.
Number 6, press ansa falak.
So, in other words, that's that point 1/3 of the way up, and I just push like that. Okay?
7, grip ansa.
And so, that gallbladder 21, I'm going to grip right there, ansa. And I just kind of try to get that muscle off the spine, off the scapula.
And then move to the right side, repeat.
Okay, so repeat.
Press, lift.
I repeat the press, spinal press. 1, 2, 3, 4, all the way up. And I do the scapula. Well, let's see, I press this point.
You're pressing your thumb in with your palm, right?
Right. And then I do the scapula lift on this side. Okay, and then I'm going to move around to the top. I could also re-grip these points here. And then I move to the top. Does it say move to the top?
Move above the head.
Mhm.
Number 9, press UB lines between the shoulder blades.
Okay, urinary bladder lines. This is the acupolarity treatment, so there's some acu points here. So I'm just going to kind of lean in, and if I press any further than the scapula, it's not coordinated. So I just press down like that a few times till I get to the base of the scapula. The UB lines are 1, 2, like that. So then I press like that. I'm going to connect those lines when I'm down at the other part. Of course, there's a big nice knot right there in that point. Okay,
Number 10, press across the shoulders.
so I'm just going to right there, shoulder press, which is in the general treatment. Okay,
Number 11, press the sides of the neck.
so I'm going to walk up like that. You know, you spend more time and care than I'm apparently doing here, but that spot right there I would spend time on. And I go
Sort
all
of
the way,
working out.
work it out, yeah. You could say if you wanted to be methodical that you just do that like about 5 times. 5's always a good number. But right there's the spot. See that? Knock it back into place. Okay.
Number 12, press GB20.
That's this point right here, which is also an acupoint. Is it cuckoo something?
Krikatikas.
Krikatikas. Yeah, I knew it was something like that.
For me, it's cuckoo.
Okay.
Chakra balance top to bottom.
Okay, so now I'm just gonna, now that I pressed her neck out, I'm just gonna kind of squeeze the neck a little bit, and then I'm just gonna 1, 2, 3, and then I push on the sacrum like that. And I kind of work back and forth that way to that way. And then remember, we did the other chakra balance where we go up here and we go right to the atlas. And then we start down here at L5. And then we just kind of walk up the spine like this. We're doing another spinal walk, except you might, the fact that we have this point right here makes it a little bit different.
So this is another type of
This is
chakra
another
balance.
type of chakra balance, but it's really more of a spinal where you're focusing on the spine. Because in our book, a chart from Dr. Stone, it talks about how the sacrum is related to the occiput, and this is the atlas is related to L5 and like that. So this is really a takeoff on that particular teaching.
The first chakra balance you showed, would you do it both sides?
No, I would
No.
just do it here because we're going to do another one from the bottom
Okay.
back up.
Right.
But the thing that I like about this chakra balance is that you're affecting the occiput here and you're pushing on the sacrum like that.
Is your direction down and away?
Yes, right. Down with my left hand it is. It's down and away. Okay,
Move to the right hip.
so the right hip, and remember she has a short right leg, so I'm keeping that in mind that she has a short right leg.
Press GB30 in opposite shoulder.
GB30 is that point 1/3 of the way between the tip of the tailbone and the head of the femur. So right there, and of course I can push like that. Or I just lean in that way. And with she has a short right leg, this is the block. The block is here. It's right here. It's on this side.
The adjustments at GB29, right?
Yeah, part of the adjustment.
But you're thinking about the
But
sacrum.
the thing
being
that pulls it
the sacrum.
is that this thing pulls the sacrum down and in and up. So, I mean, it pulls it down and the tension pulls this leg up. So the sacrum here is posterior, is anterior and inferior. This sacral bone, in theory, is posterior and superior. That's why that the left shoulder can be high,
Mhm.
and that would indicate that the right leg is short.
And that's the sacral distortion, right?
Yeah, the
Would you-
sacral distortion is the main problem.
Would you expect the PSIS to be opposite, to be different?
The PSIS.
So would the
is-
right PSIS be higher?
This, I don't know.
Okay.
This one would be higher. No, this would be lower.
Okay.
Yeah, this one would be lower.
Or maybe that's not how you think about it.
I
just
don't
curious.
think about it
Okay.
that way because I always focus on the sacrum.
All right.
And but this hip is going to be higher if that's the way that you're talking about.
Mm.
Because this is going to be posterior and superior. This is going to
Right.
be anterior and
Inferior.
inferior.
To the right leg is shorter.
Right. Because it pulls the leg up because
Okay.
the knot is here. So
Okay.
that the whole idea is that we try to release the break here.
All right. Thank you. Nitamba and work ilium points. Then ilium.
Okay, Nitamba, is the right there. So again, I would just kind of put my elbow and my thumb and I work out the ilium like that. And of course, you have to work it out according to a person's sensitivity. I mean, I'm pushing in fairly hard, but that point right there.
And then ilium to shoulder.
Oh yeah. So then this ilium is shaped like this shoulder. So I'm just gonna work out that spot there. Again, where there's a lot of manipulations, you can pick and choose the ones you like. You won't necessarily do everything. Right there feels tight. So I kind of go all the way around as I'm going down here. Okay.
Number 15, GB29 with the leg rock.
So GB29 is Nitamba, isn't it?
Yeah, Nintendo.
Okay.
Nintendo.
So then I'm gonna go like that, and then I'm just gonna rock her leg like that. You follow this, Tina?
Trying to stay out of the way of the camera.
Okay. Okay.
Number 16, walk the UB line on the leg.
All right. So I'm just gonna walk the UB line like that. The UB line is right down like that. It comes down bifurcated this way, and then it comes down like that. So 1, 2, 3, 4, for example. And then I'm going to walk with my thumbs just like that. Yeah, right there.
Yeah, that's that run I took with Paul the other day.
Number 17, hold Golfa.
Yeah,
60.
Golfa, right there.
And press Katika Tarunam.
That's Katika right there. That's at the sits bone. Okay,
And Parshvasandhi,
right there.
kidney area.
And then I'm going to go here, right there, the SI, and then I'm going to press the kidney area like that. So those are the spots. I'm holding down here, Gulfa, is that Gulfa?
Yeah.
And then I'm pressing 1, 2, 3, 4.
Okay.
Now I would do the kidney manipulation. If I was going to focus on her kidneys, then I would remember the kidney manipulation. I would find a spot here like that that's sore, and then I would just kind of walk out an area where her kidney is on the right side. Is that what it says on that sheet? FM, kidney manipulation.
I don't see that right. Oh, that's the following one, but the one directly after is leg, ankle, foot stretches with ankle shift.
Oh, okay, all right. So then let's do that then. Let's follow the sheet. So first of all, not everybody can do this, and you have to think about somebody's knees. Did you hear that?
Yeah, you just followed.
And then I press her foot down like that, So I do ankle and leg stretches, and I press to the side. And then I stretch your foot like that, back. This is called